Flu season has struck Trinidad and Tobago in a big way as well. I want to welcome to the show Minister of Health Terrance Deyalsingh, along with the Principal Medical Officer Miriam Richards. Dr. Miriam Richards, welcome to the show. Thank you very much, Mr. Minister. Appreciate having you on. Let's get right into it when it comes to swine flu. This H1N1 virus. There's a general feeling that there is a lack of information, or information is difficult and forthcoming. Is that something you would agree with?
No. But, well, first of all, good morning to you and good morning to your listeners. It's not that the information is difficult to come by. It's just that the general population every year does not absorb the information, and so each year you have to keep repeating it. I made a visit to 3 health centers last week, and I was shocked and appalled in speaking to patients there, how uninformed they are, again, about the flu season. Even though there are posters up, the nurses are talking to them. In one clinic, I spoke at the antenatal clinic to pregnant women, trying to convince them to get the vaccine. And you will be amazed of the total lack of interest displayed by these women who are pregnant, and I'm trying to explain to them the importance, not only to them, but to their baby, of getting the flu vaccine. So, and one of the nurses even went to tell me, she says when they are talking to patients, some of the patients say the government cannot force them to be vaccinated. That is true, but we are appealing to people in the subgroups, the susceptible subgroups, to get vaccinated.
Yeah, there are doctors that say potentially that some people have H1N1 symptoms, but they are perhaps scared of, for fear of, I don't know, being reprimanded or whatever, don't want to diagnose them with H1N1. You're familiar with this?
Okay, so I brought my test results because I have the flu now. It mimics H1N1. These are my test results taken 2 days ago. Read them out for the public.
Influenza type A negative, influenza type B negative, H1N1 negative.
But I have the flu. I got the vaccine Friday before last. The point I'm trying to make, and this is where the public always gets confused, we tell the public every year, the influenza vaccine, and this is where Dr. Richards will come in, will not protect you against the common cold. You can still get the common cold like I did. What this protects you against is 2 types of influenza. Okay, so you have 4 types of influenza viruses, A, B, C, and D. For human populations, epidemiological reasons, C and D are unimportant. We focus on A and B. Under A, you have about 16 subtypes, H1N1, H3N2. Everybody knows H1N1, swine flu. And then you have B. Those are the ones we focus on. And that is where Dr. Richards could tell you the difference between A and B and the common cold, and how we should recognize the difference in symptoms and get it treated as early as humanly possible.
Dr. Richards?
Yes, so the common cold is caused by what is called a rhinovirus. And there's another type of cold that's called a respiratory syncytial virus. Now, the flu shot or the H1N1 vaccine does not cover against those types of common cold. And really and truly, what we would like the members of the population to understand are the differences or the distinguishing features between the influenza virus types and the common cold. These differences are basically the onset of symptoms, the rate of progression of symptoms, and the severity of symptoms. And I'll give you some examples so that members of the public are enlightened. For example, the onset of symptoms in a common cold often takes about 3 days. You gradually become more ill. But with H1N1, the symptoms come on very rapidly in a matter of hours. With H1N1 and the influenza subtypes, there is a high fever and chills, whereas with the common cold, you may not have immediately a high fever. There is a headache. There is also a non-productive cough, and also severe body pain and chills. So if you start seeing or you recognize these symptoms in yourself or a close relative, you need to seek immediate medical attention to be assessed and tested.
Minister, there's the general feeling out there, perhaps even voices echoing that there is an outbreak of H1N1. You say there is no outbreak.
Okay, so
on what basis do you say there is no outbreak?
Okay. So we can only go by numbers, statistics.
Right.
These are the statistics from 2013 to 2019. Number of suspected cases, average 6,008, 7,000, 6,000, 5,009, started to drop, 4,006, 4,004. For the year to date, and we only have about 6 weeks again, we are down to 2,005. So based on the numbers, there is no outbreak. The number of cases are actually going down significantly. However, when you look at deaths, number of reported deaths, 2013, what are you saying there?
Data unavailable.
2014.
No available data as well as 2015.
We only started to collect data when in 2016.
Yeah.
So we had no deaths in 2016, none in 2017, 7 last year. And for the year to date, we have roughly about 14. So we only started collecting data in 2016. So whilst there is no outbreak, because the number of suspected cases are going down, we do have a concern with the number of deaths because people in the susceptible groups are not paying attention and getting vaccinated. And who are these groups? Let me, without calling people's names, give you a picture of who is succumbing to this. Risk factors, obesity, diabetes. That's a common thing throughout the 14. And we appeal to people, the elderly, 65 years and over. If you are diabetic, if you are living with obesity, you have hypertension, you need to get the vaccine. Because that plays out throughout. Obesity. Have you ever had the influenza vaccine? No. People are not getting the message in the at-risk group. Another person, diabetic. Another person, smoker, a chronic smoker. He is at risk. And so it goes. So the 5 groups we are after are 1, the elderly, 65 and over, especially if you are diabetic, living with obesity, because that depresses your immune system, hypertension. 2, healthcare workers. 3, children between the ages of 6 months and 5 years. Those with respiratory disease like asthma, COPD?
Yes.
COPD, smokers, right? Those are and pregnant women. And we are appealing again, as we did last year, pregnant women get vaccinated.
As you did a few days ago, if not weeks ago as well, you made the appeal. Dr. Richards, why are we as a country so hesitant to be vaccinated? Is it an education problem? The minister did say that nurses and doctors have been talking to their patients. So why aren't we as a country taking the vaccination process serious?
First of all, I believe that there's been a lack of uptake in terms of the vaccination simply because people have not recognized the severity and how it can affect them. At the Ministry of Health, we are trying to endorse a message of personal responsibility. So basically, we are asking persons in the high-risk groups to be vaccinated, to understand that it will prevent them from acquiring the infection, and also it will reduce the severity if they didn't, in fact, acquire the infection. And also, it adds to preventing vulnerable groups around them. So for example, if as a physician I am vaccinated, I may prevent my relatives who are in the over 65 age group or who have comorbid conditions such as diabetes mellitus from acquiring the infection. Interestingly, a study was done by the Centers for Disease Control out of the United States, and it demonstrated that the use of the vaccine actually reduced the ICU intake for patients, pediatric patients, by something like 64%. So we are really trying to push a message of personal responsibility in the population to protect yourself as well as those around you and to reduce the fear that is associated with vaccination because the risks are very low.
One of the counter arguments that I've found, that I've heard, is side effects. Is that a valid argument?
There will be side effects with any sort of medical intervention that is applied. But I can state that for the vaccine that is being used locally, which is the GC Multiflu, which is endorsed by the World Health Organization and procured through the Pan American Health Organization, the risk of serious adverse events is extremely rare. And when I say extremely rare, we're looking at 0.1%. The risk of minor adverse events, meaning redness at the site of the injection, maybe some flu-like symptoms, is also extremely low. So when we look at the risk versus the benefits greatly outweigh the risk.
Mr. Minister, do we have enough vaccines in Trinidad and Tobago?
So the government, in the days when data was unavailable for deaths, 2013 to 2014, the then authorities used to bring in about 10,000 vaccines. One of the reasons why these numbers have dropped dramatically from 6,000 and 7,000 to now 2005 is that from 2015, we started to bring in 100,000 vaccines. So we started to bring in 10 times the amount. So we have 100,000 vaccines, which is quite enough for now. At tremendous cost, the taxpayer has paid $2.50 US per dose to vaccinate these vulnerable groups. That is 250,000 US dollars. That does not count the needles and everything else. So the taxpayer has invested a huge sum of money, maybe about in total 300,000 US dollars, to protect the vulnerable groups. The vaccines are available at all the health centers, all the hospitals. We are just asking people, because the uptake has been pathetically low. We have only done about 8,000 so far. When we had the mad rush in January of this year, we did 40,000 in 1 week. We don't want that, but we want an orderly procession. 8,000 in a week and a half is very low. People still need to be encouraged. And one of the reasons you ask why people are hesitant, there's a worldwide movement called the anti-vaxxers. Anti-vaxxers are people who encourage other people not to be vaccinated.
Yeah.
And Trinidad and Tobago, pardon the pun, is not immune to that. You even have local doctors who are telling patients don't get vaccinated.
How difficult has this anti-vaccination campaign been in your...
Oh, it has been an absolute disaster when you have people going on social media sites and listening to conspiracy theories that the vaccination causes this, it causes that. It does not. And that is the major battle we are fighting. The rise of the anti-vaxxers movement throughout the world. This is a worldwide problem. And in Trinidad, it is prevalent. People have written articles condemning me for promoting vaccination.
Right, but you and your ministry in many regards have done its job in bringing the vaccines to Trinidad and Tobago. But one of the things that you came under fire for a few weeks ago was that it was too slow in coming to Trinidad and Tobago, and that you should have been, hang on, let me just finish, that you should have been more proactive and forward-thinking earlier in the year to get these vaccines here.
That is a totally ignorant statement. Let me explain to you how a vaccination cycle works. The vaccines start to be formulated by January and February of any given calendar year. What the scientists at CDC and all of them do, PAHO, WHO, they start modeling because the virus mutates or changes every year. That is why it's a yearly shot, as opposed to polio, which is for life. The influenza virus changes every year. So the scientists, based on what type of virus was circulating the previous year, make a prediction as to what this year's flu season virus will look like. And they formulate a vaccine to match that virus, which they think is going to be circulating in the upcoming flu season. Those viruses are not available sooner because they have to be manufactured. We place our orders in May of any year. You have to tell PAHO, I want X thousand, because these vaccines have a short lifespan. So in May of any year, you place your order. So in May of 2019, we would have placed our order for 100,000 vaccines. Then you have to wait for them to manufacture the vaccines using eggs, and so it's a long, complicated process. And then when it is finished being manufactured, then they are shipped to you. So no country, these vaccines are not on a shelf waiting to be purchased. They have to be formulated, manufactured, cold chain storage, and then sent out to the countries. And no country gets their vaccine before October, November for the earliest. That is a worldwide protocol.
Because of the lifespan that you speak about
Yes.
for these vaccines, you've ordered 100,000 vaccines. Only 8,000 people have taken it so far. Does this discourage you as Minister of Health from ordering such numbers?
Well, I'm caught between a rock and a hard place. If I don't order enough, and then you will come down on me and tell me, well, Minister, you should have ordered more. I ordered too much, then you want to ask me, why did I order too much? You see the problems I have, right? But it is better that you err on the side of caution and have too much. It's better you destroy 50,000 than only order 10,000, and then you have a need for 100,000.
All right. So part of it is in making use of this 100,000
Yes.
is the education campaign.
Correct.
Are there any initiatives that you and your ministry are working on to perhaps encourage people to go out there and get vaccinated with the 100,000 that has been ordered?
What we are doing now is this. This is my third appearance on a third TV station. The chief medical officer has been out. Other people have been out on radio. We have a social media campaign. We have a print media campaign. We talk to people in their clinics, as I have, the doctors, the antenatal clinics. We talk to them. I am open to any other suggestion as to what we could do more to encourage people to move from this low 8,000 uptake to a better figure. We are fighting against social media, where you have the anti-vaxxers, which are very, very present. I am again appealing, begging, imploring anybody over 65, again, you're diabetic, you're obese, get vaccinated. Pregnant population, get vaccinated. Children between the ages of 6 months and 5 years, get vaccinated. It's a battle all countries face every year. Don't think this is unique to Trinidad and Tobago. All ministers of health face this every single year because the message just does not get through. So it's something that we have to do every year.
Listen, Mr. Minister, I know that you really wanted to press home this campaign with these vaccines and to get people to vaccinate. And I hope it's okay that I also sort of change the topic very quickly as well to get an update on the Couva Hospital and when the next phase of that will start.
Well, I thought you would have been more interested in the Port of Spain Hospital.
I am interested in the Port of Spain Hospital as well. The stud turning was yesterday.
Yes, because you know that was a seismic risk and people could have lost their lives. And I don't know why people did not pay attention to Port of Spain Hospital, but everybody is focused on Couva. Why is that?
Well, it's laid there for quite a while.
But why?
And also the partnership with UE is on the horizon.
Why didn't anybody ever press the last government for ignoring the Port of Spain Central Block, which could have killed thousands of people? I always wonder that.
You're fixing that now. You tell me.
No, but I'm always wondering why the media never pressed to get answers as to why the Port of Spain Central Block, which was a risk to life and limb, was never fixed, but the media is always interested in Couva, which was not a risk to people. Why is that?
I have no idea, but we will have to. They're no longer in government, but you are now.
Yes.
And, you know, this partnership with UE, can you give us an update on it?
Yes, yes. So the hospital is currently being run by the North Central RHA as a referral hospital. We have started operations there since the middle of June. The last figure I had was over 2,000 radiological investigations have been done. So we promise the country will be doing that. We will be going out for tender because the hospital was not completely finished. And the plans we have for it, for dialysis units, vitreoretinal surgery, catheterization lab, we are going out for tender to purchase that equipment. So that will come on stream in 2020.
You know, Mr. Minister, we've got projects coming on stream set to be launched. We've got the Arima Hospital.
Yes.
We've got, you know, Point Fortin Hospital, this phase of the Couva Hospital. Do you ever worry that you won't have enough resources and people, perhaps, professional people, to sustain these hospitals?
Okay. So at the professional level, this country has always had a shortage of specialists and subspecialists. That is why we have to bring people in from Cuba. That is well known. At the other levels, RNs, nurses, and so on, we will have enough. But there's an absolute global shortage again, and this is where people think Trinidad and Tobago lives in a vacuum. We are part of a global community. There's an absolute global shortage of anesthetists. There's an absolute global shortage of geriatric doctors because people are living longer and you no longer have enough doctors. You have an absolute global shortage of ICU nurses, especially ICU cardiac nurses. So we are part of that system. So we have shortages globally and Trinidad in certain specialties and subspecialties. Otherwise, with general medicine and so on, we are okay. So there will be enough people to man those hospitals, but we will still have to continue to bring in some specialists and some subspecialists. For example, a specialist will be an oncologist, a cancer specialist. A subspecialist will be a pediatric cancer specialist. So we have a shortage of those. We have a shortage of pediatric cardiac surgeons, pediatric interventionists, cardiologists. Those are subspecialists. And then you have subspecialties where we have shortages in.
Mr. Minister, I hope you take your medicine and I hope you feel better very soon.
Thank you very much.
Thanks a lot for being on the show this morning. Appreciate it, Dr. Richards. Great having you on. Let's take a quick break. When we come back, we've got a lot more in the Morning Brew.